Hi, my name is Felicia Ellibert, registered nurse and owner of Cleansing Waters Wellness Center. Although we are a full-service wellness and weight loss center, we do specialize in colon hydrotherapy. We're members of the International Association of Colon Hydrotherapy. Today I'm here to answer a few of your frequently asked questions. What is the colon? The colon is the last 5 feet of the digestive tract. It's a hollow tube-like organ made up of muscle structure that moves digested food along by wave-like motions known as the peristaltic action. The colon is a living area for hosts of bacteria that produce vitamins such as vitamin K and some B vitamins. The colon absorbs water, nutrients, proteins, and cell salts back into the bloodstream. What is colon hydrotherapy? Colon hydrotherapy is referred to as colon irrigation, colonics, colon therapy, or high enemas. How can I cleanse my colon? One of the safest ways is a combination of diet, exercise, and colon hydrotherapy. It's a gentle infusion of filtered temperature-controlled water into the colon by way of sterile disposal rectal tube or speculum. Water and waste matter is flushed out. Some of the signs of a toxic colon are coated tongue, fatigued breath, sallow complexion, abnormal body odor, dark circles under the eyes, cold hands and feet, brittle hair and nails, sagging posture or pot belly, tension, fatigue, allergies and digestion, chronic headaches, irritability, nervousness, nausea, depression, asthma, and backaches. Is the colon the only organ that holds toxic waste? No, toxic waste is found throughout the body when toxins cannot be eliminated through the colon, liver, kidneys, or lungs. The body must store them in the tissue of the body. Some favorite spots for storage are fat cells, joints, muscles, arteries, the liver, and other organs. Will laxatives or enemas accomplish the same results? To clean out the lower part of the colon, enemas are fine, but you are missing about 4 feet of the colon. An enema only reaches the rectum and lower part of the colon, whereas with colon hydrotherapy, the entire length of the colon is reached. Colon hydrotherapy is much more effective. Laxatives are an irritant to the body, therefore the body produces a thin water substance that goes through the colon and leaves behind impacted toxins and waste. What can I expect from colon hydrotherapy? Colon hydrotherapy is not a cure, but a valuable procedure used to assist the body for a wide variety of different colon-related conditions. By returning the bowel wall and improving colon functions, the entire body is able to function more effectively. What other benefits may I expect from colon hydrotherapy? Common effects may be sinus drainage, a loosening of mucus in the lungs, improved range of motion, as well as skin tightening, feeling younger, posture automatically improving, abdomen softening and getting smaller, and relief from headaches, less fatigue, and improved bowel function. The main benefit by releasing toxic waste is that we remove the #1 source of disease in the body. The bowels work more efficiently, and the elimination of waste and nutrient absorption is improved. How many sessions are recommended? Research done by medical doctors show a series of 12 is necessary, 2 the first week, 2 the second week, and 1 a week for the next 8 weeks. The reason for that is the human body is exceptionally smart. When we clean out the colon, the body starts pulling waste out of the tissues and pulling it into the bloodstream. The waste heads to the liver, then back to the colon. Therefore, the second colon hydrotherapy session is necessary so that the digestive waste is eliminated rather than reabsorbed. The same reason applies to the following sessions. This allows slow detoxification at a gentler, tolerable rate. Is colon hydrotherapy painful or embarrassing? An impacted colon may cause discomfort, and cramping may occur as a colon contracts to expel waste. Once the colon impaction is removed, many actually find this session pleasant. The procedure is not embarrassing. Your dignity is completely maintained with proper draping in a private room. The odor during your bowel movements does not exist with the FDA-registered colon hydrotherapy device. There is no odor. What should I do before a session? It may be more comfortable to refrain from eating at least 2 hours before your scheduled appointment. Drinking lots of water and juices is a great idea. After a session, how should I feel? Most people remark on how clean and light they feel, just like they took a bath on the inside. Welcome, here's your colonic room. Your therapist will bring you in. Once you get into your room, you'll disrobe from the waist down. Once all of your clothes are off, or once you're disrobed from the waist down, you're going to put on your glove. Once your glove is on, you'll sit on the table just like if it was a chair. So you'll sit and straddle. One leg here, your bottom is here, and you're actually lying face up on the table. Here's your rectal tube. It will already be pre-lubricated, and you can pretty much move it around like you need to, just don't pull on it because it's already attached to the system. Now, as you're straddled on, you'll take your gloved hand and you'll just slide down and insert your nozzle about 2 inches. Don't worry about it going in too far because the way the table is made, it's only but so far that you can go down. Now, once you're straddled on and you're inserted, you'll have a drape sheet here. So you'll just cover up with your drape sheet. You have a call button here. Your therapist will come and get you started. So once your water is started, your colon will be irrigated with warm filtered water. The key is to hold in as much water as you can at one time, and when you feel the urge to release, just push out, just like you're having a regular bowel movement. So you hold in, and when you feel the urge, you release out. Again, your session is about 45 minutes, so that's all you'll be doing the entire time is just trying to relax, hold in water, and release it out. Once you release it out, your waste goes straight down into the system and then through the viewing tube, which is to the left of you. So you're able to watch all of the waste that's being released for the 45 minutes. The most important thing during your session is to really try and relax. The more relaxed you are doing your colonic, the better your results are. And it's important to just take some deep breaths, stay calm, relax, and just enjoy your session. Basically what happens is food goes into your mouth, down your esophagus, it travels to your stomach through 23 feet of your small intestines. This is where your large intestine starts, which is the same as your colon. Waste goes up, across, down, and out. Over the years, from eating all the foods that we shouldn't eat, the cheeses, the processed foods, the meats, from not drinking enough water, from not having enough fiber in your diet, eventually what happens, a thin coat starts to build up on the colon wall. And these pockets get thicker and thicker, and before you know it, they're impacted. If you have waste anywhere from months, even years without being cleansed, it starts to build up toxins. Colon hydrotherapy is an excellent way to remove toxins. The average adult can have anywhere between 5 and 50 pounds of undigested waste sitting in their colon. 85% of all diseases and ailments originate in the colon. The colon on an average adult is anywhere between 5 and 6 feet long. These are just a few fun facts to take home with you. Thanks for visiting Cleansing Waters, and have a great day.